Hi, I'm Claire Guest and I'm Director of Operations and Chief Executive of the charity Medical Detection Dogs. Most of our medical assistance dogs are in fact blood sugar detector dogs. And what these dogs are trained to do is alert when a person's blood sugar goes dangerously low or becomes dangerously high. Now, for many people, if you talk about cancer and cancer detection dogs, everybody immediately understands the importance of the early detection and recognition of cancer. They know that cancer is life-limiting and is a very serious condition. For many people, diabetes perhaps doesn't give the same feelings. It's not understood what problems somebody with diabetes may suffer. That's partly because of the confusion between type 1 and type 2 diabetes. Now, we train dogs for people with type 1 diabetes. So these are people that have suffered sometime in their life, often as a very young child, a viral attack which has affected their pancreas so that it no longer works. It's believed to be an autoimmune response. Once the person's pancreas has stopped working, they're totally unable to get, if you like, the fuel that the body needs to survive. And you have to inject insulin in order that the sugar that you eat is broken down into a form that the body can use. But the trouble with it is it's very difficult to get the balance right. And for some people, it's virtually impossible. Now, this is not because of a mismanagement of their condition, but it's to do with the fact that they have a very unpredictable and fluctuating blood sugar. They may take on a lot of sugar and become very, very high, or they may think they've taken a lot of sugar and take insulin, but in fact the body is responding differently and they suffer what's called a hypoglycemic event. Now, a hypoglycemic event is a low blood sugar, and it basically means that the body and the brain, importantly, is being starved of the sugar it requires to survive. Now, an undiagnosed or unnoticed hypoglycemic event results in a diabetic coma or a diabetic seizure. And for some people, they have no warning that this is happening. Their blood sugars drop suddenly and rapidly, and the first thing they'll know is that they're coming around from a coma or they're coming around from a seizure. It's very, very frightening for people, and they have no way of preventing this apart from running their blood sugars high. So you may ask, well, why not run your blood sugars high? Surely it's an easier way of ensuring that you don't go into a diabetic coma. But sadly, although the coma is the acute episode, over a longer period, say 2 to 3, 4 years, running your blood sugar high is extremely damaging for the body. And it results in all the conditions that we tend to associate with diabetes. Eyesight loss, kidney damage, damage to the fingers and toes, which sadly often results in amputation. So for these people, running blood sugars high isn't an option. And if they're unable to get their blood sugar, their hyper-awareness back, then they live very, very unpredictable lives. Many children have hypoglycemic events at school, they go into comas in the classroom, the paramedics are called. It's a very frightening experience. For parents, it can be extremely frightening overnight. They constantly get up through the night, every half hour sometimes, trying to ensure that their child is safe through the night, has not gone into a coma. For adults, many people have lost their jobs, they lose their driving licenses. Many of our clients have lost their homes. And the dogs find this work incredibly easy. Once they've been trained to recognise the odour of blood sugar, and they know that both low and blood sugar odour is rewarding to them, it's like a game. When they smell this odour, they go and warn the owner, they go and get the medical kit, and then of course when the person recognises their blood sugars are low, then the dog gets a reward. I actually do believe there's something else going on as well. Many of our dogs show an initiative and an understanding of the work they're doing, which seems to go far beyond the actual alert that they give. For example, if they can't get the person's attention, they can do a whole variety of things in order to try and get that person's attention. They sometimes do things that they're not trained to do. They may go and get help, or they may try and indicate that the person's unwell in a different way. It's all to do with the bond that the person has with the dog and the bond that the dog has with the person. Most of our clients would have had hypoglycemic events every week, every day. Many of them were calling out the ambulance once or twice a week and having hospital admissions every month. When they have their blood sugar dog placed with them, once the dog starts working, these people have no hospital admissions. They have no paramedic call-outs. It's a complete change. Many of them go back to work. they're able to live independent lives, and for parents with young children, the family are able to go back to sort of living a normal life. The child can go off and play with the friends, and in one case actually our dog actually attends school with one of our little girls, Rebecca, because she was having regular events at school and the school were becoming increasingly concerned about her. But the story doesn't stop there. There's a whole range of diseases and conditions we've discovered the dogs are able to detect. And we have one Addison's crisis detector dog, a dog that's been trained to recognise low cortisol. Now for the client, she has no adrenal glands and a very, very serious precarious condition, unfortunately resulting in many hospital admissions. The dog has learnt that when her cortisol levels become low, he alerts in the way that a blood sugar dog would. And the client is able to take medication, able to take cortisol herself to ensure that she doesn't have an Addisonian life-threatening crisis. This dog is the first in the world to do this work, and we currently have a second dog in training now for somebody who has a very similar condition. And these dogs are literally lifesavers. The people that have these conditions were often having intensive care stays, and they have a very, very serious concern that they may not survive the next episode. In addition to those dogs, we also have an anaphylactic shock detector dog. Now this is a dog that warns a lady who is allergic to so many things in the environment that it's almost impossible for her to go anywhere without having some sort of reaction. And her dog is able to warn her when she's having an allergic response, again so she can take medication that prevents the anaphylactic shock and prevents a hospital admission. But for people who have a specific allergy, say a nut allergy, we now have the first dog in training, and he's nearly completed his training, and he's a nut allergy detector dog. But what he does, he doesn't alert his owner to say you're about to have an anaphylactic shock. What he does is he checks the environment. So where she goes to work, the dog is able to check in the environment, on the desk and the keyboard, to check that nobody's put any nut oil. Perhaps they were eating nuts the day before and they've put some nut oil on the keyboard. Now if this gets into our client's eye, she'll immediately have an anaphylactic response. So the dog just checks the environment and he warns her if there are nut contamination in any of the environment.